eye diseases that damages the optic nerve, resulting in gradual loss of vision. The International Agency for the Prevention of Blindness, that's IAPB, defines glaucoma as a group of conditions that can be characterized by optic nerve damage, visual field loss. Also known as decided of sight, are usually marked by progressive and asymptomatic vision loss. Next slide, sir. The next slide, sir.
Yes.
So glaucoma is the leading cause of irreversible blindness globally. And in Nigeria, it is estimated that at least 3 million people are blind and 4 million people experience moderate to severe vision impairment due to glaucoma. That's by Adelson et al. Tam et al. In 2014 projected that by the year 2040, 112 million people will be living with glaucoma, and this will largely affect Africa and Asia.
See,
But 90%
can I advise you? You don't have to read your slide line for line or actually line by line. Okay, if you prepared it yourself, you should know what each slide has, so that you speak to the slide. Not no. This isn't a reading presentation. You are the one telling us the proposal that you have actually prepared. Therefore, you don't have to read it line by line, and then you actually talk to us, okay, while we view what the slide shows. So this isn't a reading session. Don't read it line by line. Thank you. No, you are muted.
I've muted, sir.
Okay.
We have increased age. It's common among the elderly. We have the ethnicity. So glaucoma is also common among people of black races. Family history is also a very high predisposing factor of glaucoma. Next slide, sir.
Okay.
Studies conducted to assess the knowledge and awareness of health workers on glaucoma show that there's a need for increased education on the disease. So there's a need for increased education of the disease. This is common among mainly non-clinical health workers. There's a need for increased education on glaucoma among health workers. Next slide, sir. So glaucoma is a major cause. That's the statement of research problem. Glaucoma is
No, you are frozen.
Progresses gradually to vision loss. Awareness of glaucoma can lead to early detection and disease prevention. So health education and preventive healthcare services should be programmed to include glaucoma patients and early people based on the level of their education. So awareness of glaucoma, as I said earlier too, that glaucoma is majorly a silent thief of sight. That means the damage is usually most time at the early stages might not be so visible. It's asymptomatic. So that means a higher level of awareness is necessary so that can easily detect for early detection of the disease. Next slide, sir. So despite the importance of screening, the uptake of glaucoma screening remains very low, even in some structured outreaches. So despite this, the uptake of glaucoma screening is very low. But when health workers themselves do not prioritize screening, opportunities for early detection may be missed because health workers are like the front line in healthcare delivery. So if they are not aware of glaucoma, they are not knowledgeable of glaucoma, that means our chance of detecting glaucoma early may be missed. Therefore, the assessing the knowledge and attitude and price of glaucoma screening among workers is very necessary to identify gaps and understand barriers to screening uptake and generate evidence for interventions such as easily catch the disease at the early stage. This will aid in management. Next slide, sir. So research questions. What is the level of knowledge, attitudes, and practices of health workers about glaucoma and glaucoma screening? What are the social demographic factors and other factors affecting glaucoma screening among health workers in Ondo State? And what is the uptake of glaucoma screening among health workers? Next slide, sir.
Morning, ma'am. Yes, ma'am. Morning, ma'am.
Significance of the study. The study is therefore justified because it will assess the knowledge, attitudes, and practice of glaucoma screening among workers, providing insight into existing gaps and barriers and maybe limiting screening uptake. This finding will help identify areas where training and workplace policies and awareness interventions are needed to strengthen preventive eye care. The next slide, sir. So the review of literatures. I review literatures on the knowledge, attitudes, and practice of glaucoma screening. Next slide, sir. So this is a continuation of that. Outside Nigeria too, like in Ethiopia, a study among health professionals at Nigeria General Hospital reported the high general awareness of glaucoma, but only 42% demonstrated a good knowledge of the condition. Next slide, sir.
Okay, are you still presenting?
Yes, sir. Theoretical reviews. The study is undertaken by established behavior, established by behavior and education theories that explain how knowledge and perceptions influence preventive healthcare practices, particularly among health professionals. So the health belief model. This model proposes that individual engagement in health behavior depends on their perception of risk, severity, benefits, and barrier. So on the perceived susceptibility, health workers' perception of their own and patients' risk of developing glaucoma will be studied. The understanding that glaucoma leads to the understanding that glaucoma leads to irreversible blindness will also be assessed. The belief that early screening improves outcomes and reduces blindness will also be assessed. Inadequate equipment, limited time, insufficient training, and heavy workload will be assessed as one of the causes for the low uptake of glaucoma screening. Cues to action, that means steps that might be taken to improve the level of knowledge awareness of glaucoma among health workers may include for continued professional education, hospital protocols, and national eye care policies. Next slide, sir. Theory of planned behavior. Here we will assess the attitude of health workers about the usefulness and importance of glaucoma screening, the influence of colleagues, their supervisor, and professional expectations. If there's a high chance that like for example, most hospitals in the level of knowledge of the staff is more. So the influence of colleagues is also very and supervisors very important in the uptake of glaucoma screening and the level of knowledge about glaucoma screening. The availability of skills, equipment, institutional support. Intention to screen and refer patients. Next slide, sir.
See, uh, the
Next
5 more
slide.
minutes, so you're actually spending too much time on this section.
Next slide, sir. Next slide, sir. Next slide, sir. So I can go to next slide, sir.
Yeah, wait.
So let me sampling technique. Sampling technique, sir. Sampling technique. Oh, okay. A cross-sectional quality study will be carried out. A cross-sectional quality study will be carried out among health workers. The study population will include all staff, that's both the clinical and non-clinical staffs. The only those that will be excluded will be those of the ophthalmology department, and this is because to prevent the bias, it's expected that those in the ophthalmology department, that's the eye clinic, they already have a very high level of knowledge and awareness about glaucoma, and the glaucoma screening uptake might be higher among people by virtue of what they do. They deal with that condition. So the next slide, sir. Besides the sign, the sampling frame will be obtained from the official staff list, that nominal list. It was in the previous slide, 2025. Thank you very much. The next slide, sir. The certified random sampling technique, sampling size examination. So this will be calculated in the sample size calculation for population less than 10,000. And we found 276. Next slide, sir. The sampling frame will be the stratified random sampling technique will be based on the hospital departments. Stratification by department is justified because health workers exposure to high information, patient contact, and preventive practice may vary across departments. Like I said, those in the eye clinic are more knowledgeable, and the clinical staff also, there's a very high there's a higher level of knowledge and awareness about the disease among the clinical staff. So there will be need for stratification across departments and across sections. Those are in the clinical and those are not in, and that are in non-clinical section of the hospital to also be assessed separately. Thank you very much, sir. Next slide, sir. The next slide, sir. Ethical approval for this study will be obtained from the Health Research Ethics Committee of the University of Medical Sciences, Ondo State. Participation in the study will be voluntary and informed consent will be obtained from all participants. The next slide, sir. These are my selected references. Thank you very much, sir. Thank you very much for listening.
Okay. Thank you so much for your presentation. So, and I now leave the floor open, and first of all to students. Do you have any questions for Agunloye Joseph? Students, please. The only way.
I don't know.
Yeah, continue, Oluwafemi. Yes, go on.
I don't know if you can hear me, sir.
Yes.
I wanted to ask about the sample size determination. I'm not
Okay.
sure I got how he determined the sample size clearly. I don't know if you can go back to that slide.
Okay.
The calculations and was there any previous study you used to? Yes. Was there any previous study you used? How did you come up with your prevalence? Or you just estimated the prevalence to be 50%, that is 0.5? How did you come about the prevalence? Did you use a previous study in coming up with that, or it's just an assumption?
Yes, there are two previous studies that are very much close to this study. One was done at FMC or by Kolawole et al. The other by Adegbeyingbe et al. At Ife. So there are two previous studies that are already very much close in line with what I'm working on. That's why I got the value.
And what are the prevalence obtained from the two previous studies? Because I believe that is what should influence our prevalence. I mean, the one you used in getting your sample size.
Joseph, are you still there?
Yes, sir.
Answer the question.
I didn't get the question, sir.
Kolawole, can you come back again?
You said there were two studies you checked before coming up with your prevalence. So I don't know if you have the figure for the prevalence obtained in each of the studies?
Yes.
Maybe you took an average or something before you came up with your own 50% or 0.5 prevalence.
I put it somewhere, I've forgotten the value. I know I put somewhere in the study here. Let me check.
See, what he is actually asking you is how did you arrive at the estimated in a proportion of 0.5?
It's
Can you?
estimated, sir.
But how? Did you just pick it from the sky?
No, I think on the previous
Uh,
study I did.
the,
On the
eh?
previous study that was done.
Good. How did you calculate 0.5 from the previous studies? Does that mean that you cannot answer because you are muted? Agunloye Joseph. See, if you
Yes,
can't,
I did this.
uh, how did you do it? How did you arrive at the 0.5 that you used as the P in your sample size as a calculation? Okay. Are you still there, Joseph? Oh, okay. No, thank you so much, Kolawole, for the question. So, Joseph, can you note that down? That is something you have to justify. Okay. Okay. So, yeah, thank you so much. Any other question, students? Any other question? Oluwafemi Kolawole? No, sorry. Joseph. Any questions for Joseph? Okay. If now students don't have any other question, do we have any faculty member here, any academic staff who has a question for Joseph Agunloye?
Sorry, sir, I wanted to ask a question. I'm not sure the students got the link for this presentation because the general platform, so I think it's just the health policy students that got this link.
Okay. Now I was expecting, well, I actually shared it in our departmental place, so yeah, I'm sorry. And then I also shared it with the academic staff and the HODs. So if the students didn't get it, I apologize. Okay. Any other question? Okay, now. So, Joseph, are you still there or have you logged off?
I'm with you, sir. I'm with you, sir.
Good. Okay, let's just very quickly look at the outline that you used for your proposal writing. Now, because from what you have actually presented, your proposal, it is incomplete. There are sections we actually expect. Okay, now Prof is here. Now Adin is here. So maybe after I actually commented, and I will ask him to actually say a word or two. So, the comment is that the outline that you used to write your proposal, Joseph, it is grossly incomplete. Okay, so and I know that yes, this is a KP study. Okay, and so there are certain things we actually expect in the background of your study. Now, first of all, can you explain to us again what particular study problem motivated you to choose this topic as your study of interest? Joseph, are you there?
Yes, I'm here, sir.
Okay, now, yes.
So firstly, like I explained during the course of my presentation, that glaucoma is leading cause of irreversible blindness
Yes,
globally.
yes, but
And
is that this study problem that actually
no,
motivated your
no,
study? Good.
no.
Concentrate on your study problem rather than we giving us again the background and information, so that it is actually the leading cause, that's the background and information rather than your study problem. So what is the study problem?
The study problem is that despite this high prevalence of glaucoma, there is still a need for increased knowledge and attitudes, increased knowledge and awareness about glaucoma and glaucoma screening uptake among health workers. And it's also shown that once health workers and that the low level of knowledge of health workers about the disease, it also means that it affects how early diagnosis can be made, since glaucoma, like I said, is at the early stage is asymptomatic. So early detection is very paramount. So that means we need increased level of awareness and knowledge about the disease among health workers to aid in early detection and proper management, sir.
Now, which means if I actually get you right, and the problem that actually motivated you is the low uptake of what?
Glaucoma screening.
Screening. So that has to come out very, very clearly. Okay. Usually, I ask that you write about the problem under section 1.2 of your study proposal. So that has to be very, very clear. Now, secondly, what are the goals of your study? Your aims and objective. Did you present it here? What are the aims and objectives of your study, Joseph? Joseph,
Sir,
what are the goals of your study? You told us the questions, 2 or 3 questions, and then told us also the significance of your study, but there are no aims and objectives. And then also you didn't list not also the variables of your study in your methodology. So this particular presentation is actually very, very scanty. Okay, you need actually more work, but I won't actually conclude now till we have heard from a prof, our dean, if he has any comments. And a prof, sir. Sir, you are muted, sir. Prof.
Am I muted?
Fine now.
Mute myself.
Good now.
Okay.
Sir, any
Okay,
comments, sir?
okay. Yes, I said I want to congratulate the presenter for at least getting this point to present proposal.
Yes, sir.
And I'm sure the rest, these are N5 will be presenting, and we always encourage them to present very early. These are M4.
No, for him, sir.
Supervised by, sir?
He is the only M4, sir.
Okay. Supervised by Dr. Akam. Is Dr. Akam M1 on with us? The supervisor should be present at least. And all other departmental staff. Dr. Birumbe and who else, no? And the other,
yes,
since it's online.
Yes. Yeah. No,
we need to encourage them. Even
yes.
Oladoyin too should join because she's still a candidate with us. If it's online, I think the information should be spread across to all of them very well, so that probably if we have next presentation, we have a larger staff house. But looking at the topic is relevant. CAP, but it's a CAP study.
Yes.
Secondly, I always advise that those that are doing these are actually for medical students. For there are levels of research. By masters, they should go beyond the CAP study.
Yes.
So how be it? So let all of the students take notes. There are levels of research. There are what we expect of our undergraduates. There are what we expect of master's program. Then the PhD program. Everybody cannot do the same thing. And we've always put distinction at every level on this. So let everybody note. CAP studies is not at the level, it's not supposed to be for master's students. Thirdly, I want to congratulate the presenter. At least you have gotten to this point. And the disease he's studying is a rare disease, glaucoma.
Yes, sir.
But you are talking about knowledge, attitude, and practices of glaucoma screening for glaucoma. If you are going to do that, it's better you do it in the community so that you can have how many people have screened. You are doing glaucoma screening among workers, health workers. What are you going to get from that? The workers are supposed to be trained people. So why do you want to assess their knowledge? You want to assess the knowledge of a doctor about glaucoma screening. Does it make sense? You want to so are you going to are you training them? Is it an in-service training? So this study should actually be knowledge, attitude, and practice of glaucoma screening among the community. So you cannot do it among healthcare workers because it's not, you are not, yes, you want to train them in service training, but it doesn't make sense. They should know and they should be able to, they should be aware of training and we should put it against the standard. But it makes sense. Even at the community, you can ask then that is practice. But for practice among healthcare workers, what do you want to ask them? You want to ask them, somebody that is not an ophthalmologist, that how do you do what is screening? It's not his field. Or you want to ask the two, where that they may not know anything. So what do you want to get out of it? So I advise you do this general community, and from there, you can now say, currently managing and so on. So that is very important in this your presentation. You should rather do it as a community based, or at least among patients attending clinic, so that you know and you can ask those questions and you can get, and you must look for standard questionnaire comparing when the standard, what is the average standard? I did not see that in your questionnaire. So you must bring your questionnaire and discuss the questionnaire you want to. Is it you yourself that generating it? But there are standard questionnaire on glaucoma also, which you can tap into on the line and bring those standard questionnaire and apply it to the community. So, like I did and then your methodology will have to change, and we have to multi and community-based study, and then you choose community west local area. Details are you going to do? And your data analysis, you need to, like I said, you need to construct a questionnaire. Go and look for WHO glaucoma screening, and it must be, it's the standard, and so that you will know the questions that you want to ask. The most important variable is, have you ever screened glaucoma? Then you must ask, do you have glaucoma? That means there will be some people that have been diagnosed. Then that will be, so those are basic things that you need to see, and those are basic issues that you need to see and discuss. But my question is, how is this related to health policy? Okay, these are M4. So,
HPM. That's a question, sir, that I also wanted to raise. That actually studies being done by HPM students should actually relate to HPM. Maybe it is actually too late now, but that is something that our students should actually consider.
Because they are M4.
Yes.
Because they are M4, we could allow them, you understand?
Yes, sir.
But it can actually tailor it towards health policy also.
Okay,
those are my few comments, but I think you should we will have to go back and rework all those things that we have said.
Okay, sir. Thank you, sir. Sir, thank you so much.
Yes.
So, Joseph, just as I said, we can't accept this particular proposal that you presented. So you need to go to actually rework it. And I know you are actually M4, and so you don't have actually much time. But you need to actually rework this particular proposal, and you actually represent to me for me to check that it is actually complete and correct, and that you take take also the comments of our dean. The fact that he says this particular study should be community based, which means you have to practically change everything that you wrote in your proposal to reflect that. Do you understand?
Yes, I do, sir.
Okay. So, any other questions? Well, since Prof has actually spoken, I think we'll go on to the next presentation by Oluwafemi Kolawole. So I will share his okay. Okay. Kolawole, over to you.
Okay.
15 minutes starts now.
Thank you, sir. So good morning. I am Oluwafemi Kolawole. I would be speaking on impact of co-payment versus non-co-payment health insurance on medication adherence among hypertensive patients in Ondo State. I'm being supervised by the acting HOD as policy and management, Dr. Osahon. Please, next slide, sir. As a background, cardiovascular diseases, which hypertension falls in, is responsible for a huge part of the global mortality figure, 43% as of 2021, and an estimated 1.3. This is just to give us a background of how huge the burden of hypertension is. Hypertension, one of the key ways to manage hypertension is through medications, because it could be, most times it is chronic. So medication adherence then becomes important. There's a need for clients to continue to take medications. So, and if these medications are not taken, antihypertensives are not taken, it could lead to complications like kidney disease, heart failure, and all of that. And financial barrier has been proven to be a key determinant of medication adherence. Next slide. Health insurance is a key health finance mechanism that has been introduced to improve access to healthcare services and medications. Co-payment, there are two forms of health insurance. There's a co-payment form of health insurance where enrollees get to pay a certain percent of the cost of medications, while for example, the NHRA, National Health Insurance Scheme, health insurance scheme, falls under co-payments. The non-co-payment method do not involve patients paying a dime. One of it is the Orange Health Insurance Scheme presently run by the Ondo State Contributory Health Commission. These variations in health insurance structure can affect adherence outcomes. Next slide. Medication adherence generally has been reported to be poor in low and middle income countries. In Nigeria, medication adherence has also been proven to be a key barrier to adherence. We talked about that earlier. Now, limited studies have compared co-payment versus non-co-payment health insurance models in Nigeria. This is one of the reasons why I'm going for this study. So there are no local evidence to really guide if co-payment and non-co-payment forms of health insurance should be encouraged. So there is a need to do these comparative studies between co-payment and non-co-payment. Next slide. Okay, so cost of medications, even under insurance, can still be a limiting factor to consistent medication use, that is adherence, as proven by Regbeshola in 2018. We've talked about limited evidence confirming co-payment and non-co-payment. These findings from these studies will influence health policy decisions, insurance design, so that we'll know that, okay, should we continue to do co-payment? Should we continue to not do, should we switch to non-co-payment? Of course, there's a conversation of moral hazard. People just go to the hospital, want your me and paying premium. So they want to access healthcare, either they need it or not. Next slide. So what are my research questions? Main research question that is a broad, covering the broad aim. What is the impact of co-payment versus non-co-payment health insurance scheme on medication adherence among patients with hypertension in Ondo State? Sub-research questions: is there a difference in medication adherence when you are comparing hypertensive patients in these two structures? How do medication cost and other factors, because not only medication cost influences medication adherence. So how do these other things, they are modifying factors, co-variables, well, we're going to get there. How do they also influence medication adherence? Next slide. Non-hypothesis is that there is no statistically significant difference. Alternate hypothesis is that there is a significant. Next slide. This is basically. Okay, so theoretical framework. The framework that guides this research is essentially head belief model. I'm not going to talk about it because of time. I'm just going to stress on the one that focuses that this research is really talking on, which is perceived barriers. So the barrier in this context is financial barrier, because clients, even if they see the importance to use their medications, but they don't have the money to purchase the drug, or they have to pay a certain percent of the money. That 10% that NHIS patients pay to access healthcare is used to some people. So how do these influence the choice to want to refill their medications or not? The other things also influences it, but this study directly talks on perceived barriers as next slide. Conceptual framework. The independent variable is the form of the health insurance payment structure. Is it co-payment or non-co-payment? The dependent variable now is the medication adherence. How well do people do hypertensive patients take their antihypertensives? The co-variables, the moderating variables that can also influence how deep these dependent variables influence the independent variable, medication cost, income level, and all of that. So these moderating variables can dictate how strong or how weak the relationship between the independent and dependent variable is. Next slide. So research goal, I've pretty much explained this when I was talking about research questions. So research goal, the broad goal is to assess the impact and the objective. So I've pretty much talked about this actually. So next slide. What have I done? How did I go about my literature review? I used systematic literature review where I follow step by step. Okay, I checked what is my intention. After doing that, I brought out my the database I'm going to use. When I got my databases, I screened the journal, the research that I was able to come through. Actually, I reviewed close to 30 research papers to check. Then I screened them and all of that. So the scope, the theme, these were the themes I used. My databases were basically PubMed, Google Scholar. Most of this PubMed research now linked me to WHO reports and all of that. So I used these keywords. I used the Boolean expression or so that my search results can come out clean. Next slide. I think I mentioned that earlier. Health insurance. So what did I find from my review so far? I found that health insurance improves access to medications, but co-payments may reduce adherence.
Okay.
But the studies I found did not exactly compare co-payments versus non-co-payments directly in Nigeria. Hypertension adherence, like I said earlier, has been reported to be generally low to moderate, especially in middle and low income countries like Nigeria. These factors, cost, knowledge, and regimen complexity. How complex is the regimen? Is it just one daily? Is it 2-3 times daily that becomes difficult for the client to adhere to? This have also been proven to influence medication adherence. Medication cost also is another thing that proven to influence medication adherence. Next slide. So what has this literature review findings taught me? So existing evidence shows insurance improve access, but co-payment may reduce adherence. So most studies I said earlier compared insured patients versus uninsured patients. They didn't really compare insured patients as a whole, now comparing the payment structure. Most of them just compared insured, that is people that pay out of pocket and people that are insured, not considering, people that still pay co-payment amongst the insured enrollees. So, most of the evidences I saw were from high income countries, and Nigeria is a developing country. We might not exactly copy and paste whatever finding we form to Nigeria. So it shows that yeah, I talked about this. And then on the methodological gap, I saw that most of them relied only on cross-sectional and quantitative study. And let me go ahead of myself. That is why I intend to use qualitative and quantitative mixed method research. That is what I intend to do, subject to my supervisor. So theoretical gap, I also noticed that most of them did not use theoretical models in explaining behavioral models, sorry, in explaining adherence. And they also did not consider socioeconomic realities and health system factors like drugs going out of stock. They didn't really use, explain that. Next slide, sir. So this is what justifies why I need to do all these things, why I need to do context-specific evidence within an Ondo state, why I'm using a mixed method research. I've said that. Why we need to investigate cost-related barriers, like what I've pretty much talked about. So this thing will now help us with policy relevant recommendations. We can now say, okay, NHIA should go to non-co-payment form of health insurance if we are going to get substantial evidence from this study. Next slide. Mixed method research, I mentioned this is what I'm using. So the study design is analytical cross-sectional. That is under quantitative now. I intend to use questionnaire to that end. My analysis will be done using chi-square and all of that. There's also for the qualitative part, I intend to do in-depth interview. I will select out of the study size for sample size for quantitative. I intend to select about 10 to 15 amongst them for in-depth interview. Now, the final sample size will be dependent on how data saturation. If I don't get new things they are saying again, I can stop at 10, I can stop at 11, but I don't intend to go beyond 15. So the fact, I said that most of the other studies I saw only used quantitative. That is why I'm using these two. So that beyond the figures, why is this thing happening? Qualitative will give me that. But already you can imagine that alone will cost so much. We'll get there when we get the budget. Next slide. Study area is Ondo State, Southwest Nigerian population. The health insurance, so Ondo State is a good place to use because Ondo State offers both co-payment and non-co-payment in the sense that the National Health Insurance Scheme and release in Ondo State use non-co-payment, while Orange Health Insurance Scheme that has a release of about 111,000 uses non-co-payment. I intend to the healthcare system of Ondo State, tertiary, study sites. I intend to use one facility in Ondo State that have both enrollees of NHIS and Oranges, and that's hypertensive enrollees. They offer, I think I've talked about it. Next slide.
Okay, now 4 more minutes. 4 more minutes.
Okay, sir. Study population, adult patients with hypertension. I've talked about this. Inclusion criteria: patients that are less than 18 years old with hypertension, not less than 6 months, and they give informed consent. Next slide. I don't want to go against ethics. Exclusion criteria: people that out-of-pocket patients are not within my context, within the context of my research. Critically ill patient, people that cannot explain, that cannot give me the figure I need, the data I need, and people that decline consent. Next slide. Sample size determination. I used the previous study, which was reported 39.2% adherence was reported. Usman et al. 2019, and then I got my sample size to be 410 after accounting for attrition. So I intend to allocate 205 between both. That is 205 for Oranges, 205 for NHIs. Next slide. Qualitative, I've talked about this essentially earlier. Next slide. So I intend to use sampling technique. So after I will use simple random sampling for the first to get one facility so that all the facilities know that renders both oranges and NHIS have a fair chance of being selected. Then after that, I use balloting to detect which of the clinics to use. Then I stratify which oranges and NHIS, and then I allocate, it's self-explanatory. Next slide. Qualitative purposive sampling I'm going to use purposive sampling out of the quantitative samples. I'll select 10 to 15 people that can give me good information until data saturation is reached. Next slide. Talked about this already? Yes, I have. Next slide. Data collection tool will be semi-structured interview or administer questionnaire for quantitative and in-depth interview for qualitative. We are going to use the Momrisky scale to classify adherence. Next slide. I'm going to do my pre-test in a similar facility that attends to both NHIS enrollees, co-payment and non-co-payment. And I'm also, in this pre-test, I'm going to check, okay, are my tools adequate? Are there things I should correct before I go to the main test? So next slide. Of course, this thing is telling me I'm going to spend money. Validity and reliability, I'm going to train my research assistants because, of course, I can't administer questionnaire to the whole of 410, but 425 if I had the qualitative. I'm also going to closely monitor to be sure that I get the accurate data that I need. Next slide. I'm going to obtain the ethical approval from the Health and Research Ethics Committee of UNIMED, and I'm also going to ensure that I get informed consent from these participants before administering the questionnaires or the IDI for qualitative. Next slide. I'm going to do my data analysis using this. Next slide.
Yeah, time up now.
Okay. Final, I just wanted us to see the budget.
Okay.
Next slide, there's a part of the budget. My study limitations, this is my proposed study duration. I'm thinking it will be around this time, 4 to 6 months and all of that. And this process will be followed. This is my study budget. This alone, this figure is an estimated budget. This alone is more than 2 times of the cost of UNIMED school fees. An average salary of, I'm saying it will take a while. So it will take much. So I intend to see if I can collaborate with people, with health insurance agencies, that we can work together to get this data and hopefully maybe put up a publication that will influence policy decisions. Thank you.
Okay, good. Thank you so much. So we open the floor for fellow students to please ask questions. Yes, please. Any questions? And for Kolawole? And the students, please ask the question, because that is the way you show that you are participating.
Good morning, sir.
Hello, good morning. How are you?
Yes, sir. Dr. Olamiji Bitoye, an MPH Ed Policy Management student. From Kolawole, thank you for your presentation. I'm actually interested in the budget because for me, I was trying to work on getting the budget, but I didn't know how you arrive at that. So maybe sharing your insight, how you arrive at all these budgets, these prices for different items will help me in my own budgeting. Thank you.
Thank you, Dr. Lamji. So this is an estimated budget. I came up with this budget based on my, for example, printing. I estimated, okay, I'm going to print for 420 people, 410 people, then 15 qualitative IDI. I'll have a structured, so I just estimated how many pages how much they print per page and all of that. I'm going to make calls. I'm going to also onboard research assistants I'm going to onboard them to help me. I'm going to train them. And nobody will do anything for free, anything for you for free in Nigeria. You have to incentivize them, give them something. I don't know how much ethical approval is. I don't know. So I just give an estimate, like I said, and then so this is just like an estimate. It could be more. I doubt if it will be less, but it could be more.
Thank you so much. Pumiro to me, your hand is raised.
Good morning, sir.
Hello, good morning. How are you?
Thank you very much for the presentation, Mr. Kolawole. My name is Bumirotimi, MSc Epidemiology and Biostatistics student. I am interested in your literature selection.
Okay.
I really appreciate what you did, in selecting the literature. I want to ask, in selecting those literatures from, you said you selected 30 literatures, if I can get you right. Did you do a critical appraisal of those literatures that you selected, and what checklist tool did you apply? Thank you.
Thank you. So
thank you, sir.
already using my search terms, it kind of already, I think the earlier slide before this talks about the search terms I used. Yes. So that already streamlined the responses I got. I mean, the suggestions I got from my databases. So after getting that, I now checked, okay, how many of this research, which one is talking about health insurance adherence, which one reports adherence, for insured patients, which one talks about, which one is context, which one has been done in West Africa or Africa that is close, I can adapt to Nigeria, because I saw a few in Nigeria actually. So those were the things that I used to streamline them, that okay, this is better, this is better, this is better. Which one talks about medication adherence? That was the one I used. There was one about Usman et al. That I used for sample size calculation. So those were the things that helped me streamline to get the ones that are relevant. Usually, the use of the keywords really helped, and I kept using so health insurance and Nigeria, health insurance and West Africa. Okay, I think there was some I did West Africa when I didn't get for Nigeria. So those were the things that helped me streamline to get relevant ones.
Yeah.
Yeah, that was what I did.
Yeah. Now the question he is actually asking, you have not really answered. What he is actually asking is, how did you assess the quality of the articles that you selected for review?
Yes, sir.
Did you use a CASP checklist, JBI a checklist, a pyramid of evidence as a platform? How did you decide which article has good quality for for your review? So what tools did you use to critique the quality of those studies that you selected in your literature review?
Yeah, so essentially is CASP.
Now, did you use CASP? If you didn't use it, you just admit that you didn't do any critique, then we move on.
Well, I tried to use CASP,
Okay.
but I had a little time. So I tried to use CASP to check, okay, did this thing really follow what I intend to do? But time did not permit me to really go through all the journal,
The
over 30
process.
journals. In fact, yes. So I didn't.
Now, because in a way, your literature review method, which is not systematic, you must follow the procedures. Usually 4 or so steps that you must follow. Then the second step is actually the step where you do a quality assessment. Okay, so that has to be properly explained in your proposal. Okay, thank you.
All right, sir.
Yeah. Yeah. Any other question from our students? Okay. The faculty members, if we actually have them here, do we have any academic staff here? And if you have any question? Okay. No, apparently none. Okay. So now, for me, and I know that I actually supervised your work, but I have only seen just only chapter 1. Okay. In chapter 2, chapter 3, you haven't. No, I have not seen, and in fact, I actually expected you to present just only the chapter 1 that okay, I have seen. But then now we say you have been very, very brave. You have worked very hard for you to include chapters 2 and 3 with with your presentation. So the only question that I have is that it appears as if you were actually confused with your study variables. During your own presentation, I'm not sure you actually stated right. Your presentation said actually the correct thing, but the way you actually read it wasn't actually correct. No, which particular variable is your dependent variable? Now, which ones are the independent variables? So you actually mix them up during the presentation, even though, just like I said, they were very clear on the slide. But I just want you to be sure that, look, what you wrote on the slide was what you actually meant, because you actually presented them the other way around.
Yeah, okay. So the independent variable is the payment structure. I don't know if you can hear me, sir.
Yes, I can hear you.
The independent variable is the type of health insurance, that is the co-payment or non-co-payment. The
Okay.
dependent, which is the one that changes depending on what, that is the medication adherence.
Okay.
So I don't know if I said something else. Why the co-founding ones are the socioeconomic status, level of income, and all of that. Maybe I said something else when I was speaking.
Yes, yes, of course. So now I think I am actually okay. So well, as your supervisor, I wouldn't actually say much. So well, one, I am actually happy that you stuck with the outline that I gave. Okay, so and now you actually basically need to have to fine tune it, and I will need to see the full proposal. Okay, before I can actually give you approval for your ethical approval application. Okay, is that clear?
Yes, sir. Thank you, sir.
Okay, good. So now our next presentation is by Adeyemo James. Is he still here?
Yes, sir.
Okay. That is Ugnagos Power. Okay.
Yes. My phone is actually having some challenges, so I got a phone from a colleague to use.
Okay, fine. Okay, so now the third presentation, Adeyemo. Yeah, here.
No, sir, I've sent another stuff to you, sir. I sent another.
Huh?
the proposal presentation. I sent it to you, sir, not quite long.
Eh,
Because of the challenges that I was having with my phone, so I did not see the outline that you gave.
okay,
So
that
it was
means
later
then,
that
because you actually sent it after the presentation started, I can't really go there now, and so I think I will upload it, but that means you will present last.
okay, sir.
Okay. The next presenter is Olamiji Ibitoye. Sorry, let me get there. Yeah. Oh, what is Ibitoye's work?
Assessment of the sustainability of the state level earth financing mechanism
Yes. Yeah,
using
go on.
Ondo
Go on.
State as a case study.
Okay,
Okay,
go
sir.
on.
Good morning, everyone. My study topic is assessment of sustainability of the state level earth financing mechanism using Ondo State as a case study. My supervisor is Dr. Ogbeiwi. And please, next slide, sir. Okay. Earth financing perform three core functions, and which is to raise fund, pool the raised fund, and then strategic purchasing. And this is also central to achieving universal health coverage. Nigeria continue to face underfunding, high out-of-pocket payments, fragmented risk pools, and donor dependence. And over 60% of the population are experiencing multidimensional deprivations in terms of ability to seek healthcare. So, and hence there's need to intensify the sustainability of the financing mechanisms. Ondo State operates a mixed approach where there's budgetary allocation, state health insurance schemes, basic health care provision fund, which is co-funded by states and federal governments. And then to a large extent, we have out-of-pocket payments. Next slide, sir. So this study is necessitated by these problems that I found, which involves unpredictable budget releases, corruption in the implementation of these resources, weak accountability, and then low public trust as a result of this corruption and weak accountability system, which goes a long way to undermine the state's health financing sustainability. In Ondo State, there's not just low budget. We have recurrent delayed disbursements of these budgeted funds. And we also have low enrollment. I think about 6% of the population is currently under one health insurance scheme or the other. Then we also have limited risk pooling due to this low enrollment in the available health insurance schemes. There's a public distrust driven by the perceived corruption, reduced willingness to prepay and participate in the schemes. Then the consequence of this is that there's going to be continuous high out-of-pocket payments burden in the states. There will be inequity, and this will stall the progress of universal health coverage. Next slide, sir. So the purpose of my study is to provide empirical evidence on subnational health financing sustainability using Ondo State as a case study. This is justified by the inconsistent state-level implementation of national frameworks, such as the NHI start of 2022 and the BACPF Provisional Fund Program. So this study will inform policy. We add to the body of information, body of knowledge to inform policy reforms in Ondo State and in states with similar context. Then strengthen fiscal space and public trust, then contribute to the universal health coverage and sustainable development goal 3 achievement. Next slide, sir. So the following are my research questions. We have, what are the principal state-level health financing mechanisms in Ondo State and how are they structured? To what extent are these mechanisms sustainable in terms of resource mobility, predictability, and long-term viability? How do stakeholders perceive the strengths of these strengths, weaknesses, and barriers to this sustainability of this health financing mechanisms? Then what are the policy reforms that can enhance sustainability of state-level health financing in those states? Next slide, sir. So these are the research hypotheses. First is state-level health financing mechanism in Ondo State are not sustainable under conditions of economic volatility. Then second is institutional weaknesses, corruption, and low fund releases significantly reduce predictability and efficiency. Donor dependency, the third is donor dependency undermines long-term viability of financing mechanisms. And lastly, public distrust in government reduces enrollment in prepayment schemes and willingness to contribute. Next slide, sir. So the theoretical and conceptual model I'm working with is that the conceptual framework is that sustainability is assessed across 3 dimensions, not just one. We have resource mobilization, efficiency, and long-term viability. So this this is what the study is going to, the conceptual framework the study is going to be based on. Then the theoretical framework for these studies is from the WHO Health Financing Framework, which emphasizes that public financing and broad risk pooling is key to achieving universal health coverage. The political economy also is where government's ownership is key, and stakeholder alignment will drive the achievement of universal health coverage. Next slide, sir. Next slide, sir. Okay, thank you, sir. My aim for this study is to evaluate the sustainability of state-level health financing mechanism in those states, Nigeria, and propose actionable recommendations. My specific objectives are as follows: identify and describe key health financing mechanism in those states, assess sustainability across mobilization, efficiency, predictability, and viability. Analyze stakeholder perspectives on strengths, weaknesses, and barriers. Then lastly, propose evidence-based policy recommendations from the findings of the study. Next slide, sir. So these are the methods I followed in my literature review. I use the narrative review with thematic synthesis. Then the scope was from global to sub-Saharan Africa, and then now focused in Nigerian literature from the year 2016 to year 2026. These are the databases I used to get some of the literature review, Google Scholar, and so on. Then the keywords are also used in searching includes the following, but not limited to this: health financing mechanism in Nigeria, universal health coverage, BACPF, National Health Insurance Authority Act, sustainability, corruption, and public trust vis-a-vis health financing mechanism. Next slide, sir. So the literature review from the global to sub-Saharan Africa showed rising health spending, but persistent universal health coverage financing gaps and weak strategic purchasing. We have Delima Ito, Ansen, and Karamagi. So in Nigeria, we have low public spending, high out-of-pocket payment, fragmented health insurance and health insurance scheme, and uneven BHBF implementation. These are well documented in Owu Jekwe and Odineu Anago, the research they did. Major challenges also include corruption, low funding release, and donor dependency. Next slide. So there's strong national level analysis, but there's rigorous state level mixed method case studies are limited, which my study we had to the body of knowledge. Evidence consistently showed that problems of corruption, eroded public trust, and but from the literature review, we have all this, but few on practical and context-specific solution to these problems. Then the gaps in Ondo states, few Ondo and subnational studies, weak triangulation in methodology, where some studies just focused on secondary data, some just on there's actually no mixed method. The mixed method studies are limited. So, and also there's no political economic lenses in some of these, in most of these studies. Thank you. Next slide, sir. So these gaps, these are the implications for these gaps. There's need for urgent, in-depth state-level case studies that integrate fiscal data with stakeholder perspectives. This Ondo State study, the one I'm going to do, will also directly address the identify empirical and methodological gaps. Next slide, sir. So the research method I'm going to use is as follows. For the study design is a cross-sectional case study. The approach I'm going to use is a mixed method approach, where there will be quantitative data from fiscal and the survey data. Then qualitative data will be gotten from the stakeholders, interviews, and focus group discussions. Then there will be triangulation with quantitative and qualitative data to enhance robustness of the study. Next slide, sir.
5 more minutes. So.
Yeah, my study area is in Ondo states, 18 local government of the states, and the study population is 5.3 million. The Ondo State is selected because of active health financing reforms and availability of budget and implementation data. Next slide, sir. So my target population are state health officials, insurance administrators, facility managers, donors, civil society, and so on. The inclusion criteria is that the participants has to be adults, 18 years and above, knowledgeable about health financing, and able to communicate in English or Yoruba. Exclusion is persons below 18 years or lacking relevant knowledge of health financing. Next slide, sir. So quantitative sample size is 384 using the Cochrane's formula. Then the sampling method is multi-stage sampling. The qualitative data will obtain key informants interviews from about 15 to 25 people. Also, there will be 2 to 4 focus group discussions using purposive and snowballing sampling methods. Next slide, sir. So the dependent variables here are sustainability score, perceived trust. Independent variables will have revenue composition, budget release, patterns, corruption indicators, donor dependence. So measurements will be budget analysis, enrollment trends, composite scoring, and thematic analysis of perceptions. Next slide, sir. So study instruments is going to involve structured questionnaire, semi-structured interview, focus group discussion guides, documents, review checklists. Data sources include state budget, BSBL record, NHI, and so on. The collection will be done via surveys, interviews, focus group discussion, and document extractions. Next slide, sir. So on data reliability, triangulation of multiple data, we make the data more reliable. We will pre-test our instruments, and then we'll also use standardized protocols and member checking to ensure qualitative data. Next slide, sir. So quantitative data will be analyzed using SPSS. Qualitative will be analyzed using thematic analysis, using target. Data will be stored securely, it will be anonymized and backed up. Next slide. So our ethical considerations will obtain approval from the Ondo State Health Research Ethics Committee, and also from the Institutional Research Ethics Committee in UNIMED. There will be written informed consent. Will ensure confidentiality, anonymity, and voluntary participation. Next slide, sir.
Time up.
I'm almost done. It does limitation and study duration. So these are the limitations that I may likely face in the course of doing this study. Next slide, sir. So the study duration is estimated to be between 2 to 3 months, and the our budget will cover personnel, data collection, transcription, software, travel, and contingencies. So I've not put a figure to it. That's why I asked Famkola Wale if he could share his ideas with me so that I can be able to properly estimate. Thank you, sir.
Yes. Okay, thank you so much, Ibitoye. So, the students, do you have any questions for Ibitoye Olamiji? The students, any question for Olamiji Ibitoye? Are we still there? Did you
Yes,
hear?
sir. My question.
Yes.
My question would be on the sample. I'm always interested in sample size. For your sample size, Dr. Lamiji, I think I saw 300 and something samples, people that you're going to ask questions.
Yeah. But
Yes.
he didn't tell us how he actually calculated it.
Yes, I think he said he used Cochrane formula. Is there a why did you go about it? I think I'm interested in that part. I think I saw that you mentioned Cochrane's formula and all of that there.
Yes. So looking at the population of Ondo State, I quoted it in one of the slides, about 5.3 million people. And using the Cochrane's formula, I got 384. So for the quantitative data that I'm going to obtain, but for qualitative data is purposive. So relevant persons are going to be people that are expected to know about the strengths, the weaknesses, and perceptions are going to be selected for the qualitative part. So that's how I came about the numbers.
So for quantitative, it will be service users, right?
It's
That you're
going to
administer the
span
questionnaires
across. No, it's going to span across service users, civil society organizations that should know a thing or two about
Okay.
health insurance, community stakeholders. People should have knowledge about this. Healthcare workers, people who who actually implement health insurance in their facilities and all that. The head of the institutions, government appointees in the ministries.
Sorry, so it means quantitative will still be purposive. Your sampling method for quantitative will still be purposive, since you are selectively giving civil society people that should be knowledgeable about health insurance, health financing.
I don't think that's purposive. It's not as if I'm gonna. It's just that these people are the ones that will be able to actually in one way be able to know what I'm studying. Do you understand? So these are the people that will know what I'm studying is going to involve people in those areas, those walk of life, not just, I can't just go to the organizer on the way and be asking about health insurance or asking about what do they know about government policies and all that. So it still has to be policymakers and people that knows about what I'm studying in order to be able to get relevant informations and be able to.
Can you explain your steps of the multi-stage sampling? So how can you prove to us that your selection of your sample actually will be random and not purposive?
Okay. For the first stage, facilities, the local governments with either state specialist hospital or teaching hospitals are going to be every local government has primary health center, PHC directors, and all that. But in order to get this number of people, the local governments with teaching hospitals, of course, they will have general hospitals or state specialist hospitals with primary health centers, with PHC directors and all that.
Yes. How will you select them?
So I'm going to arrange them either in descending or ascending order and randomly choose.
And the LGAs, how?
The LGAs.
The steps on this particular slide says you will select this the senatorial districts first.
Yes. Okay. Senatorial districts.
How many of them do you have?
We have 3.
3. Okay.
Yes. So, and out of these 3 senatorial districts,
okay,
minimum of 2 local governments will be randomly selected.
Okay.
Yes.
That is at that stage. Okay. Now, the LGAs, how will you select the LGAs?
No, that's the LGAs I'm talking about, sir. These 3 senatorial districts are we are going to use the 3 senatorial, but out of these senatorial districts, we will choose, we'll select local governments with, based on the following characteristics: states, either state specialist hospital or teaching hospitals.
That is
and a total of 6.
That is actually purposive.
Okay.
If you select based on the criteria that is actually convenient for your study, that a particular sampling method is a purposive sampling. So, but if you actually select DLGAs probably randomly or actually stratified, those that have and those that they don't have, so then actually people can then say it is not under purposive. Okay, if you can show the scientific approach that you used for your sampling at that level, then by the time you also select, after selecting DLJs, what is the next the next stage?
It will be selection of the hospitals, civil society bodies, and societies. Key. Yes, the groups,
So,
different
good.
groups.
Yes.
Hospitals,
groups. So that particular stage is actually missing, because from this particular slide, you said you are going to move from a selecting VLGs
okay,
to selecting participants.
Yes,
Therefore, there is that particular stage now missing, that particular level missing on your slide.
Yes, sir.
Okay, now the hospitals, the groups, the organizations, how will you select them?
Their selection is going to be random, but the managements are going to be, I think it's going to be stratified. Management, nurses, doctors, and then out of them we'll randomly select the participants.
In a stratified, what particular formula will you use?
I can't remember right now, sir.
Okay.
I will check it up, sir.
That is something you need to actually check up. And now, any other question from my students? Okay, academic staff, if there. And if not, I want you to explain, first of all, your literature review. What is your strategy? You actually, okay, how exactly did you select the studies and articles from these particular databases using these keywords? What was your literature search strategy? Now, do you understand the between? Do you understand?
Hello, sir.
Yes? Yes?
I didn't hear you for a while.
Okay, sorry
I
about
didn't hear
that.
you for a while. I think the network.
Yes. And I said, what was your literature search strategy? Again, what was your literature search strategy?
So, hello, sir.
Yes, go on. Okay. He has actually signed off. Okay, fine. And whenever he actually connects, we will finish with him. So I think while we wait for, okay, he's back. Okay, I was
Hello,
actually,
sir.
yes, go
I
on.
was network glitch.
Yes.
So I didn't get the question, sir.
Okay. And the two questions that I want you to to explain. What was your literature search strategy? And then what was your study design? Explain these two, and then we will move to the next presenter.
Okay, my literature strategy involve using this earth financing mechanism as a key, comparing from the global perspective, earth financing mechanism, and I got some literatures from
Yes.
Asian countries.
Now describe how the steps, the step-by-step approach that you used until you selected your final list. How many articles did you even review? Did you state
I
how
don't.
many articles that you reviewed?
I didn't state how many, but
Oh no.
there were lots of articles, more than 25 that I came across, more than 25, and I had to streamline them, the one that are relevant to
Good.
earth financing mechanisms
Okay.
in the global perspective,
Yes.
in the sub-Saharan Africa, and also in Nigeria. So that was how I was able to identify the gap of limited. I think in the whole sub-Saharan Africa, I think it was about seven
Yes.
that was relevant. And in
Okay.
Nigeria, I think Nigeria was about maybe 3 or 4 or so. So there were global studies done from the one done in Singapore, China, and all that identify the need for stakeholders ownership, government ownership, and all
Yeah.
that. So I read through them and identified the ones that are relevant to my study, and those were the ones I selected.
Now, many did you find irrelevant to your study?
I don't have the number at hand now,
but if you did a literature
I
review,
downloaded them. And read through. But
now the other students, please, your literature review, you should be able to tell us the number of studies or literature or books or journals or articles and studies that you selected and that you reviewed. And then you should also tell us the steps that you chose, that you followed. And first of all, you actually select those that are relevant to your topic. Okay. And after doing that, those ones that you selected, you actually screen them for at your quality. So at that stage, you will need to actually critique the quality using CASP checklist, using JBI checklist, whatever checklist that you use to actually determine which ones that the ones that are relevant, which ones were quality papers, the quality literature, and the quality studies. Then before you now examine for eligibility using inclusion and exclusion criteria, which you now list. Okay. After eligibility, then the next thing is that now you now read the full text to then say that, okay, we actually selected so number that we have found to be eligible. But after reading them, we only found only 10, only 20 had the evidence that were actually relevant to relevant to the purpose of your review. And then those 10, those 20, you need to know the number. They were what you now reviewed, to obtain your literature review findings. Okay, and that is the steps. That is how it should go. And so that please, when you submit, your full proposal to me, and for approval before you go on to apply for ethical approval, okay, and I need to see how you have actually followed this particular structure in your chapter 2. So then the other question, sir, is your study design. So this particular slide doesn't tell us properly. It tells us your approach, but the design, the approach comes first before the design. Okay, but now you have put the design first before the approach. Okay, so the approach is a methodology, which you've said is mixed method. Under mixed is the methods. There are mixed methods of the design. Also, Kolawole, you also didn't tell us what your mixed method on the design is. And then you don't just say we actually combined quantitative, qualitative. There are 4 or so specific designs for the mixed method approach. Okay, so you need to actually specify what is your mixed method on a study design. Then now, before you now, when you now describe that particular design, then you can now say this was how we mixed the quantitative, qualitative. The qualitative, the qualitative design was a cross-sectional. Which one again is cross-sectional case study? So that is, and again, I'm mixing 2 things. So these particular designs are, you need to actually fine-tune it. What exactly do you mean by?
I actually mean cross-sectional study. Cross-sectional study.
Which one again is the cross-sectional case study? So please correct it, so that now, before you not tell us about the quantitative design, which is a cross-sectional study, then you also tell us about the qualitative design. Okay, there are also different types. In the case study, or narrative study, or the phenomenological study, or or whatever study designs. I'm sure I have actually given you a framework of the different study designs. Look at that and be actually specific. Do not leave gaps because the examiners that will look at your dissertation, they'll be looking for gaps, such as this, for them to actually determine whether your dissertation is whether it actually reports a good quality study or not. So that these are the two things that are. So please do these corrections. Send me your proposal, chapters 1 to 3, okay, and for me to see before I can. Well, if your supervisor approves the corrections, please send your corrections to your supervisor, and then when he is actually okay with it, please now send it to me, and for me to see, to now ask you to go ahead to apply for your ethical approval.
All right, sir. Thank you, sir.
Okay, good. And thank you so much. So, Jesus told me sing. Or, yeah. Okay, I think we can still take one more. Okay, Jesus told me sing.
Okay,
Okay,
sir.
and are you there?
Yes, sir. Good morning, sir.
Just hello,
I'm
good
yes, sir.
morning.
Good morning, sir.
Well, good morning.
Yes, sir.
Yes. Okay, now
Okay,
15
sir.
minutes.
Okay, sir.
We start counting now.
Okay, sir. So my research proposal topic is titled the assessment of essential medicines availability, accessibility, and patient satisfaction under the Orange Health Insurance Scheme. A case study of selected high utilization accredited health facilities in Akure South local governments. Next slide, sir. Next slide, sir. Okay, so these are my outlines. Next slide, sir. The background of the study. The study is actually premised on the understanding that health insurance is expected to improve access to healthcare services. And like we all know, universal health coverage cannot be achieved without access to essential medicines. Globally, there's evidence that suggests that there's a major challenge with drug availability. Next slide, sir. Next slide, sir. Okay. So over the years, there have been various healthcare financing reforms to ensure and improve access to essential medicines. But even at that, we still have evidences that suggest that medicine availability at healthcare facility is still facing some challenges such as poor forecasting, financial constraints, and it remains a major determinant of effective healthcare services. Next slide, sir. I've talked about, health insurance is supposed to reduce financial barriers by reducing out-of-pocket expenditure. And there are evidences that suggest that with the scheme, there are still reports of medicines unavailability. And evidence regarding medicine availability and accessibility within the state schemes remains limited. Most of the studies are based on NHIA, National Health Insurance Authority and Scheme. Next slide, sir. So the next slide, sir. Okay. So we have the Orange Health Insurance Scheme, which is an initiative of the Ondo State government to improve access to healthcare services through financial risk protection. But we don't have, there's limited evidence regarding the availability and accessibility of drugs under the Orange's program within accredited health facilities. The study problem, I think I've talked about the study problem. There's problem of medicine stockouts, supply limitations, and most studies focused on NHIA and the general service satisfaction. So there's limited service evidence about state health insurance schemes. So these studies seek to assess essential availability, accessibility, and their relationship with patient satisfaction. Of the study. At the end of the study, I would have generated evidence of medicine access under state health insurance scheme, contributing to achieving universal health coverage to improve access to essential medicine. These are the study questions. The next slide, sir. Study questions. Next slide, sir. Okay. There are four study questions. The first one is, what is the extent of availability and accessibility of essential medicine in selected high utilization oranges accredited health facilities? Then the factors that influence this availability and accessibility, what are they? Then what is the level of patient satisfaction with access to essential medicines? And then, is there a relationship between essential medicine availability and accessibility, and also with patient satisfaction among oranges enrollees? Next slide, sir. Study hypothesis. There are three study hypotheses, no hypothesis. The first one is that there is no significant association between essential medicines availability and patient satisfaction among oranges enrollees. Then the second one is that there is no significant association between essential medicine accessibility. And then the third one is that no significant association between facility-related factors and essential medicine accessibility. Theoretical model. Next slide, sir. Okay. Theoretical model is going to be anchored on the Navidian quality of care model. And this model explains three factors: whether the structure and processes within health facilities, whether they influence an outcome. So here we have the structure as availability of medicine, the drug supply system, the financing mechanism, then the processes. How do they obtain drugs? What are the dispensing practices? What is the waiting period, waiting time like? And the service delivery processes, how are they like? Then the outcome is the patient satisfaction. So this model suggests that adequate healthcare structure and effective processes influence healthcare outcomes. Next slide, sir. So this is the conceptual framework. Meaning that there are facility and health system factors that influence essential medicines availability and also influence essential medicines accessibility. And the availability of these essential medicines, it can also influence the accessibility. Availability is the drug physically present, being physically present when they need them, while accessibility is how can the patient obtain this prescribed medication, and then the patient satisfaction. So availability and accessibility directly influencing patient satisfaction. Next slide, sir. The broad aim is to assess the availability and accessibility of essential medicines and determine the association with patient satisfaction among oranges enrollees under the oranges insurance scheme in high utilization accredited facilities. And these are the objectives too, in relation to the study questions. Next slide. So the literature review method, systematic review method was used, and the Prisma framework was used, where we identified relevant articles, relevant studies, peer review studies, then screening them to remove duplicates, because there were some studies that applied more than once. Then looking at the eligibility, there were some outcomes that were not speaking to what I was actually looking for. So the search keywords that were used: medicine availability, drug accessibility, patient satisfaction, health insurance, essential medicine supply chain. And the search period was between 2015 and 2026. Next slide, sir. Okay, so total people reviewed over 20 peer review studies with other key institutional reports like WHO reports. And the findings based on the teams were divided into four: availability of essential medicine. There were evidence that confirmed that there are inconsistency in the supply availability of essential medicines in healthcare settings. evidences suggesting that we have stockouts, evidences suggesting that health insurance accreditation does not automatically guarantee continuous availability of medicine. And then the second thematic area is accessibility of essential medicine under health insurance. There are also evidences that suggest that patients will incur additional costs by purchasing medicines outside the insurance scheme. Next slide, sir. The factors affecting medicine availability and accessibility. There are evidences to suggest that supply chain factors influence drug availability and accessibility, financial factors, and then facility level factors like human resource capacity. Then we have patient satisfaction with health insurance services. There were evidences to suggest that availability of healthcare services, waiting time, they influence patient satisfaction. But then there were just few studies that specifically measure the contribution of mental availability to patient satisfaction. And most of them were about NHIS enrollee. There was no much study talking about state insurance and patient satisfaction relating to that. Next slide, sir. The discussion. From the literature review, the review evidence shows that medicine availability remains a major determinant of effective healthcare access. Then it suggests that insurance accreditation should be supported by effective procurement system, inventory control mechanism, adequate financing, and then the assessment of oranges performance should, based on this, the assessment of oranges performance should not only focus on enrollment, but also service utilization on whether the drugs are available at the health facility. Then for the team accessibility of essential medicine. Next slide, sir. Okay. So accessibility, there are evidences that suggested that accessibility is multi-dimensional. So therefore, assessing oranges medicine accessibility require both facility assessment, want to do the facility, and then measuring outcome through assessing the patient to know about their experience, patient's experience. Next slide, sir. Then the factors influencing medicine availability and accessibility. They were mainly supply chain weaknesses, procurement practices, stock management, funding mechanisms, pharmacy operations. Next slide, sir.
5 more minutes. So.
Next slide, sir.
5 more minutes.
Satisfaction and medicine access. So, existing literature demonstrated that patient satisfaction is an important measure of healthcare service performance, and it rarely examines whether patient satisfaction is affected by availability and accessibility of prescribed medicines. So this study extends existing evidence by examining the relationship, want to see the relationship between medicine access and patient satisfaction among oranges enrollees, that is state insurance scheme. Next slide, sir. Research gap. Categorized into 3, we have the knowledge gap. There's limited evidence on essential medicine availability and accessibility.
Okay, you are frozen.
Can you hear me, sir?
Now, yes, now.
Can you hear me, sir?
Now, yes. Yes. Continue.
Can you hear me, sir?
Yes. Yes.
Yes, we can hear you. From this to me.
Oh, okay. Sorry. So we have the methodological gap. Previous studies assess either the facility medicine availability or patient satisfaction, availability and then patient satisfaction. And then there was a contextual gap where the evidences were mainly on NHI and tertiary health facilities. There was not much evidence on state insurance schemes. So next slide, sir. Okay. So the implication of gaps for further study. There is need for facility level assessments to know if essential medicines are actually available under the state health insurance scheme, and then to identify the barriers that are affecting their accessibility. like I mentioned, the accessibility is, can the patient actually obtain this medicine? Then the need to understand patient satisfaction, because it's going to help to improve health outcomes and better the health system. Then there's need to, it will provide evidence to strengthen Orange's implementation. Next slide, sir. Okay, so this is the study methodology and design. Descriptive cross-sectional, because data is going to be collected at a single point in time. The variables will be observed. There's not going to be any manipulation. Then we assess the essential medicine availability and accessibility, the factors influencing this, and then check if there is an association between accessibility and availability, whether they influence the patient's satisfaction at a point in time. That's why it's cross-sectional. Then is cost-effective and time efficient, and it's going to be quantitative. Next slide, sir. Okay, across South local governments and Orange's accredited facilities will be the study area. Next slide, sir. Okay. The target population will be healthcare workers that are actually involved in drug management. So basically pharmacists, pharmacy technicians, and sometimes facility managers, because there are some facilities that you might not have trained pharmacists or pharmtech manning the drug, the pharmacy station. Then, because the study is going to be divided into two, looking at the availability and accessibility within a facility, and also measuring patient satisfaction within that same facility. So, for the patient satisfaction assessment, Orange's enrollee receiving care would be the target population. Next slide, sir. The inclusion.
Okay.
Next slide, sir.
Yeah.
Okay, sir. Inclusion and exclusion criteria. Like I said, Accurate South LGA, high utilization facilities. The definition for that is greater than 2,000 Orange's encounter per quarter. There are some facilities, accredited facilities, that don't really have enough enrollees. So I might not be able to, using them, I might not be able to measure and reflect, it won't reflect the operational realities at those facilities. So the staff that are involved in drug management and services, and then Orange's enrollee. The exclusion criteria is as stated there too. Next slide, sir. Okay. So for the sampling technique, the stage one is purposive selection, because it's about those that are actually involved, the Orange's accredited facilities, and those that are involved, eligible health workers that are involved in medicine management. So the stage one is to select the accredited facilities. Stage two is to select the healthcare workers that are involved in medicine management. And stage three is to sample Orange's enrollees that are attending the facilities. Next slide, sir. The sample size determination using the Contran formula calculated as those, because there was limited study on state insurance scheme. So the p-value is at 50%, that's 0.05. And the N is 384, but because might have no response, to account for non-response rates, 10% of that added to it, we give 422. Next slide, sir. Okay, so for the facility sampling, it is going to be based on, like I said, greater than 200 enrollee encounter in a quarter, and the information is going to be gotten from the encounter register from ODCAC, Ondo State Drugs and Ondo State Contributory Health Commission. Next slide, sir. So the main study variables, the independent variables are the drug availability, essential medicine accessibility, and then the related factors. Then the dependent variable is the patient satisfaction. And then there may be other variables like facility characteristics. Is it a public? Is it a private? How is it being financed? And others, and the location, the social demographic characteristics. Next slide, sir.
Now time up.
Okay. Let me move to data okay, the ethical consideration. Let me move to the ethical considerations then. So ethical approval will be obtained from the appropriate ethics committee at UNIMED and then at the state level. Then the Ondo State Constitutional Commission at the end of the facilities too. We have to give permission to get across to the staff there. And then participation will be voluntary, and I will ensure that there's no personal identifier so that the privacy and is protected. Then the limitation, next slide, sir. The patient responses may be affected by perception bias. So that is going to be put into consideration. And because facility records will be checked to know if actually, because a checklist will be used to know, do they have this drug? When was the last time they got it? So their facility record may be incomplete, may limit the studies. And because we are using greater than 2,000, I'm hopeful that the low utilization facility will be automatically ruled out with that. The next slide, sir. The study duration and timetable. The proposal development, ethical approval, data collection, data analysis, and data reporting is as shown. And then the study budget is also as shown. But it's an estimated budget. These are the references. Thank you.
Okay, thank you so much. Thank you so much. Thank you so much. So, students, do you have any question for Tumisi and Tony? Yes? Any comments, no questions for Jesu Tumisi? Everybody is quiet.
Well, so mine is a comment.
Okay.
The topic is really a very good topic. It will further bring to light in our drive for universal health coverage. Okay, how are patients really, are they really assessing these medications? Are they getting, we are doing insurance, but are people really assessing these essential medications? So
Yeah.
it's, for me, it's a comment. It's I just want to congratulate her on the job.
Okay.
Thank you. Well done.
Thank you so much. Yes. Any other comments or questions from students? Okay. Now the question that I want her to answer for me. And first of all, you outlined your variables to be the independent variables are what? Can you remind us again? Remind us what exactly.
Other variables.
Yes. What are your variables? And then how are they defined in your study? Yes, Jesu Tomisi, you are muted. What are your study variables and how are they defined?
I didn't get questions, sir. The network got affected.
Yeah, sorry. So what are your study variables? How are they defined? And then that will lead to the main question that I want to ask. Okay. Did you hear my question? Did you hear my question? Okay. Jesu Tomisi.
Hello, sir.
What are your variables?
Yes, sir. The network was constrained. I didn't get questions, sir.
Good. What are your study variables and how did you and how will you define them in your study?
The independent variable are the variable that we affect. They are the ones that we influencing variables. Why the dependent variable is the one that is being influenced by that something causes it, not the actual.
No, specify then. Specify.
It's an outcome. The dependent variable. Okay, sir. The dependent variable is the patient satisfaction, which is the outcome. Dependent variable is the outcome.
Okay.
Patient satisfaction.
Okay. And the independent variable.
They are the influencing factors that
Of
will lead
what?
to that might produce the outcome,
Including
the availability of essential medicines, accessibility, and facility-related factors.
okay. So if these are your study variables, so what did you say is the main problem or your study problem that has motivated your choice of this topic?
Is accessibility.
Accessibility. That is the
Yes,
problem.
sir.
And
Yes, sir.
therefore, what do you want to know about accessibility as your focal study problem?
Okay. I want to know if under the state health insurance scheme, if patients can easily access their medication. And then the secondary focal point is now to know if the accessibility, if it influences the satisfaction of patients.
So, okay. And then they are all related to accessibility.
Yes, sir.
Whether they access as a medicine, and then whether the patients are satisfied.
Yes, sir.
And the reason why I want you to have to clarify this is that your study population, they are not patients. In your study population, they are healthcare workers. So how exactly do you defend that?
Okay. The study population is divided into the facility. At the facility level, that's where we have the healthcare workers involved in drug management. But because we want to measure the patient satisfaction too, the study population for that one cannot be the health workers. It has to be those people receiving the services.
Yes, but that didn't come out clearly in your presentation. So, for me, the advice I will actually advise you is that if your study problem is just accessibility, so why are you combining accessibility and availability, and then trying to actually connect them to patient satisfaction? And shouldn't patient and satisfaction be the main problem? And maybe you have found out from your own experience that the patients and the patients who use a certain health insurance on the scheme are not happy with the services they actually receive. And then you want to now find out what are the factors that are responsible. Then accessibility factors, unavailability factors, and then the other factors of the health insurance scheme will now come up as the independent and available of a patient dissatisfaction that you really want to study, or that actually should be the problem of your study. Do you understand what I am saying?
Yes, sir.
So that this might mean that you go back again to please look at your proposal by you redefining what your study problem is, what are the variables, and then who are the people you need to interview. If it is actually health workers, and then stick with them. If it is in the patients, and then stick with them. No, and the simpler your study is, and the better for you. Do you understand?
Yes, sir.
Okay.
Thank you, sir.
And
Yes,
so
sir. Thank you, sir.
please, yes, and so please edit into your proposal, and send it back to the supervisor. Tell her, and I think it is him, Abi. Who's your supervisor?
It's Eve, sir. Dr. Yeneyi. E.
Okay, good. So
Dr.
tell him,
Abiodun Yeneyi.
good, and tell him the comments we have made, that the study problem, the variables, and then the target population, they are not actually clear to me. Okay. Yes, it is a good study, as the caller Wole has actually remarked, but it needs to be properly defined. Okay. Okay, now do you understand?
I understand, sir.
Okay, so
Thank you, sir.
now do the corrections, and then send again the proposal, for us to see that the corrections have been made. Okay. Okay, before we can then give you approval for you to apply for ethics. Okay, and so now we have our last as the presentation is the one from Adeyemo, and he said he has sent me his new. Did you send it by email?
Yes, sir. I send it to your mail, sir.
Okay, let me search for it. Okay, so yeah. Yeah, please. Okay, you can start your presentation now. Okay, now 15 minutes, please.
Good afternoon, sir, and good afternoon, my fellow colleagues. So I'll be presenting on the topic regulation of antimicrobial sales and its effect on antimicrobial resistant trend in Ondo City, Ondo State, Nigeria. So background statement. Antimicrobials have transformed modern medicine. Inappropriate access and misuse have accelerated antimicrobial resistance. In many low and middle income countries, antibiotics are frequently sold out without prescriptions. Antimicrobial resistance threatens effective treatment of infectious diseases and increases healthcare costs. Now, next slide, sir. Problem statement. Unregulated antimicrobial sales contribute to self-medication, inappropriate antibiotic selection, incorrect dosage and duration, and increased antimicrobial resistance. There is limited evidence on how stricter regulation influences antimicrobial resistance trend in many settings. Next slide, sir. Aim: to evaluate the effect of regulating antimicrobial sales on antimicrobial resistance trend. Next slide, sir. Specific objectives: assess current antimicrobial sales regulation, to determine compliance among pharmacies and drug vendors, to compare antimicrobial resistance trend before and after regulatory implementations, identify factors influencing compliance with antimicrobial regulations, recommend strategies to improve antimicrobial stewardship. Next slide, sir. Research questions. What antimicrobial sales regulations currently exist? How effective are these regulations? Does regulating antimicrobial sales reduce antimicrobial resistance? What barriers affect implementation? Next slide, sir. The significance of this study is to support evidence-based policy making, to improve antimicrobial stewardship, to reduce inappropriate antibiotic use, to strengthen national antimicrobial resistance action plan, and to improve patient outcome. Next slide, sir. Literature review. Over-the-counter antibiotic sales are associated with increased resistance. Prescription-only policies often reduce inappropriate antibiotic consumption. Regulation should be combined with enforcement and public education. Next slide, sir. Conceptual framework. Regulation of antibiotic sales and reduce over-the-counter antibiotic use, and appropriate antibiotic consumption, and reduce selection pressure, lower antimicrobial resistance trend. Next slide, sir. Methodology, study design, cross-sectional or experimental. Then study population, which is within Ondo city community. So we have to consider the community pharmacists there, the patent medicine vendors there, healthcare professionals, and the various laboratory records in some health facilities in Ondo city. So data collections. So we have to use questionnaires, pharmacy audits, then antimicrobial resistance surveillance data. Then we can conduct interviews. And sampling method. Can use random and purposive sampling. Data analysis. Descriptive statistics. Q-square test. Then logistic regression trend analysis with the p-value less than 0.05. That is like 50%. Next slide, sir. Expected outcome: improve compliance with antimicrobial regulations, reduce inappropriate antimicrobial sales, reduce antimicrobial resistance trend, evidence to strengthen national antibiotic policy. Next slide, sir. The timeline. So the literature review and proposal approval will take within a month, then 2 to 3 months for data collection, then 3 months for data analysis, then about like 4 months for the reporting. Next slide, sir. Conclusion. Regulating antimicrobial sales is the key intervention against antimicrobial resistance. Effective enforcement, public awareness, and antimicrobial stewardship are essential in combating this. These are my references, sir. Thank you, sir.
Wow. Wow. Okay. Yeah. Okay, fine. Thank you so much, Nadeyemo James. Now, students, any comments, any questions? And students, if you keep quiet, then that will mean and all of you are actually complicit, because this particular presentation has features that should make you students, if you're paying attention, to comment or to ask questions.
Yes, sir. Thank you, sir.
Yes.
Well done, fam. My concerns are that I'm not sure the presentation followed the outline.
Yeah.
That's
Clearly,
my
it is
concerns.
not complete. It is grossly under. Nicola Ole, continue. Sorry that I
So
interrupted.
I feel maybe you might have to, so that we can have a proper grasp of what you intend to do. The idea is good. The idea, I mean, I can see, even from the topic, I can see the intention. But again, there has to be a few work that even the topic in itself, it sounded to me as though you want to regulate, and you also want to
Let me show it.
yeah. So but I understand the intention. The intention is you want to look at how regulation of antimicrobial seal can affect
Reduce resistance.
yes, can reduce antimicrobial resistance. I understand the intention, but I don't think it's exactly well stated in the topic. It's not well stated in the topic, but I understand what you intend to do. So that's one. And then going forward, the topic did not exactly, I mean, the flow, the earlier part,
Yeah.
I can't see, so I got all these problem statements.
It
The
was
latter
all
part
over
was
the
really,
place.
yeah. So I maybe you need to maybe do a few more work on that answer.
Okay, thank you. Any other comments on the students?
Good afternoon, sir.
Yes, well, good afternoon. Yeah.
Good afternoon, sir. My name is Babalola Puforola, MPH Epidemiology Biostatistics.
Good. Thank you so much. You're welcome.
Thanks, sir. I agree with what Mr. Fakola also said. The topic, please correct me if I'm wrong, sir. It sounds as if you want to regulate antimicrobial cells and now check its effects.
Mm-hmm.
That's how the topic,
Yeah.
the way you have portrayed, that's how it sounds to me.
Yep.
So I just want to know, is that what you intend to do? Or
Yes.
maybe the topic needs to be rephrased?
No,
That's my question.
So, who is your supervisor?
You are the one, sir.
Me?
Yes, sir.
I am not sure I have seen this. I have not seen it. I have not seen it. Have we met? And have we had any supervision meeting?
No, sir.
And so then how can okay. So please sincerely, the proposal that you presented can't be defended today because it is incomplete and it doesn't flow logically. You know, just as you heard, the title, and also the variables, they are not very, very clear. And ideally, you shouldn't have come over to present until I have seen the proposal and I have approved the proposal for defense. And by you telling me that you want to actually present, it appears as if you have jumped the gun.
Sorry, sir.
Yes, you have jumped the gun, and that is why the defects in your presentation is so obvious.
Yes.
Now going forward, now yourself and also Agunloye, okay, you need to book a session with me for me to actually take you through the outline that you are expected to follow. Okay.
Okay.
The other students, please, in effect, enter the corrections in your proposal. Okay. Get your supervisors to approve the corrections that you've made before you send me the actual proposal in Word or the document. I will read them, and then I will be the one who will then tell you whether the proposal is actually okay for you to go on to apply for ethical approval or not. So, and for now, I want to thank all of you for attending these particular presentations today. So, and I hope we have learned one or two things that will help you improve the quality of your proposals, particularly writing the chapters 1, 2, and 3. Okay, I look forward to hearing from Joseph and James, and then for the other of you, to receiving your supervisor approved of the proposals going forward. So, any other questions? Any other comments? Okay, so if we don't have any comments until probably next week, Wednesday, when our PhD students will be presenting their own seminar, I will advise that if you can also connect to that the same time next week, Wednesday, and for you to hear the PhD students present, that would be very good. So, thank you so much, everyone, and have a wonderful week. Thank you. Bye.
Thank you, sir. Thank you, sir.
Thank you, sir. Bye, sir.
Okay, bye-bye, yeah.
Thank you, sir.